about the workflow in the billing office. At the end of the day, once all the patient appointments are over, the doctor's office is going to scan and upload all the patient-related documents pertaining to that day to the billing office. Now, this is done either by uploading the files to a file hosting server like Dropbox or to a secured cloud service like Amazon Web Service, also known as AWS. Now the next step is to download these files, and this is taken care by the IT department. The downloaded files are placed in the server, and a copy of the scan log is given to the team lead. The team lead will then verify if all the files have been received without any missing information or missing pages. Once that is done, the team lead is going to allocate the work to his team. And at the end of the day, the team lead has to update the manager about the work status and queries. Queries are any missing information from the doctor's office, either patient documents or treatment information. The manager will then update the doctor's office about the file status, how many files have been completed and how many are still pending, along with the queries through email. Now, before we get into the next step, let us first understand what is a practice management software. A practice management software, also known as a medical billing software, is a type of software utilized by the doctor's office and facilities to help perform day-to-day operations. Things like demographic entry, charge entry, claim processing, cash posting, AR analysis and denial management, and patient statements. Usually the doctor's office will have administrative access to the practice management software, and they will provide the billing office with the login credentials. Now, coming to the next step, which is demographic entry or patient demographics. In this, the demo entry team is going to enter personal details like name, date of birth, address, telephone number, insurance details like member ID, group number, etc. Now the next step is medical coding. In this, the coding team will convert diagnosis and procedure text from the progress notes or super bill and convert it into ICD and CPT codes. Now this is done in order to bill insurance companies and to get reimbursed from them. The next step is charge entry. In this, the charge entry team will enter provider and treatment details like doctor name, date of service, diagnosis codes, procedure codes, place of service, charge amounts, etc. The next step is claim processing. Once the demographics and charges are entered into the practice management software, they are audited by the quality team, and then claims are generated and forwarded to the clearinghouse for further processing. Claims once received by the clearinghouse are checked for errors, and this process is known as claim scrubbing. And claims without errors, also known as clean claims, are forwarded to the insurance companies. Claims with errors are rejected, and a claim rejection report is sent back to the practice management software. Now, the billing team is going to work on these rejections, and they are going to resubmit the claims. Insurance companies, after processing the claims, are going to release payments to the provider through EFT, which is electronic fund transfer. The corresponding ERA, which is electronic remittance advice, will be uploaded or updated in the clearinghouse website. Now, in some scenarios, providers are paid through paper check. Then a copy of the EOB, which is explanation of benefits, is sent to the doctor's office address along with the check. Now, coming to ERA, it is an electronic document which contains details like insurance name, claim process date, billed amount, allowed amount, copay, deductible, denial reason, etc. Now, coming to EOB, a document similar to ERA which contains payment details and other information but in a paper format. Mostly secondary insurance payments are received through paper checks and EOB. Doctor's office scans all the paper EOBs along with the paper checks to the billing office on a regular basis for the payments to be updated on the patient accounts. Now, the next step is cash posting. In this, the cash posting team is going to update the payment details on the patient accounts based on the ERA and EOB details. Denied claims are handed over to the AR department for follow-up. Now, the next process is AR. In this, the AR team is going to work on denials and fix them, follow up on long outstanding claims pending with insurance companies by calling them. Now, the last step is patient statements. Patient statements or bills are sent out on a regular basis as per the client requirement to collect the balances owed by the patients towards their cost share and also towards non-covered services.